In clinical practice, we meet many young people who have had experiences of trauma. If you become aware or you suspect that possibly this is so for the young person that you're seeing, start off being quite tentative in your questioning or in your discussion, and be aware that sometimes young people have never talked to anybody about their experiences, and this could be quite distressing and in fact be re-traumatising. Ask a young person about, or say, for example, that you come across young people who have had bad experiences and you're wondering whether that might be the case for them. Is it okay if you ask them some questions? And follow their lead. If they say that they don't want to talk about it, then it's usually best to leave it like that. Or if they say they don't want to talk about it, you might ask them about, what would make it okay to talk about. If a young person discloses a history of sexual abuse, there are a number of things to think about. Could this still be going on? Is the young person safe now? That's a very important point to try and be clear about. The next point to be clear about is, has this young person talked to anybody else about this? Does anyone else know? What would the young person like to do about this? And there's also informing the young person about that perhaps you will have a duty of care to actually inform others about this. So particularly if this young person is a minor and is still has contact with the person that they are saying has abused them, then you can't keep that information to yourself. And thinking about explaining to the young person why that might be the case. What do we need to do as clinicians? Who do we talk with? Do we have a peer group? Do we have supervision? Is there someone that we can talk about the impact on us of doing this kind of work? Clearly, if a young person's very distressed, so you're not just going to let them walk out of your office, indeed. So you might say to them, would they like to sit in another office? Would they like a cup of tea? Do they want you to call anybody that they might that might be a support for them? Are they okay to go home and spend a bit more time and see what you can do about rearranging your appointments, or if you have a bit of flexibility? But explain to a young person what you're trying to do and why you're trying to do that. When a young person discloses that they have had a traumatic experience, it's really important to acknowledge their experience. It's important to say something empathic, to show that it's okay for them to talk to you about this, that this is a safe environment, you are a safe person for them to talk to.